This morning we are speaking to Dr. Lola Ogbonlowo, a family medicine physician, class of 2014 in Leesburg, Virginia. And doctor, I want to welcome you today. And can you just please tell us a little bit about what you're currently doing?
Thank you for having me, Scott. And so
Sure.
I'm a private practice physician here in Leesburg, Virginia, and started my private practice in 2022. This was coming off of the heels of COVID, and at that time decided I wanted to create a safe place for patients where they could feel like they were family, and to provide a place where I could imbue my practice philosophies in their health journey. I got tired of hearing a lot of patients say that they were not being heard, they felt rushed through appointments,
Sure.
and that they didn't have a physician who was knowledgeable. And so I knew that that was something that I could fill in the gaps.
Okay. And now you started what I believe you said is a full spectrum family medicine practice. Could you just explain a little bit what you mean by full spectrum?
Yes. And so full spectrum just means that as a family doctor, we see everyone of all ages, and we also can do a lot. And so, as far as primary care is concerned, most people envision just going for their annual physicals, but it's a lot more than that. And as a full practice or full spectrum family physician, we see women for gynecology care. So we're putting in birth control, so IUDs and Nexplanons and doing pap smears. We're seeing people for obesity medicine and talking through with them about nutrition and helping to get their weight down. So then that in turn will control chronic conditions. We're doing dermatology, so we're taking skin biopsies. We're doing some orthopedics where we're also doing joint injections. So full spectrum family medicine just means that, we're trained very broadly and we're working at the highest level of our training.
Wow, I didn't realize that family medicine doctors do things like dermatology and gynecology. Wow, so that it really is a full spectrum indeed. Okay, so for current and prospective students, could you just perhaps tell us a little bit for those who may not be familiar, what family medicine is and why it's a specialty future doctors might want to consider?
So family medicine is a great specialty. It's a little bit of everything. We get trained very broadly, and unlike specialists who may only focus on one organ system, we are treating the whole patient. We see the patient as a whole. And so, a patient comes in and you're not just focused on their heart, but they may come in for palpitations, but it may be as a result of their thyroid function being out of
Sure.
being unstable. And so we can treat them accordingly and not pass them back and forth and, um, you know, give them the runaround because we don't know what's going on.
Okay. And can you please tell us a little bit about your experience in urgent care? I know that you had some experience in urgent care and family medicine. Could you just talk a little bit about that?
Yes. And so my experience has been as a family doctor, when I first trained, I was very interested in all aspects of family medicine, which, as we talked about, there's a lot that we can do in the office, but there's a lot that you can do outside of the office, urgent care, hospital medicine. And so I did some moonlighting when I first started as an attending, did some moonlighting in urgent care for a few years, and that was amazing. The things that you may not see in the office. So, treating a long laceration, casting, those were things that we got to do a lot of in the urgent care. I also did some rounding on the hospital, so some hospital medicine. So, I would see patients in the clinic, and when they were admitted to the hospital, I would also see them there. I only just recently let go of that. But it really just helps to fully allow you to see all aspects of the patient's care. And it helps you to really understand when they come back to the office how to go about getting them stabilized.
Okay. And you are also currently certified in obesity medicine. And can you just tell us a little bit about how you help patients lose weight and get healthier?
Yeah, so obesity medicine is a relatively new specialty on its own, although we've always been practicing obesity medicine. Of course, we have the crisis of obesity in our country, and we found as family doctors that it has led to a lot of all the chronic diseases that we treat. And we found that if we were able to adequately explain to patients how to get their weight under control, then we saw diabetes and hypertension and asthma and COPD and sleep apnea and other chronic conditions um, resolve. And so I went into obesity medicine as well to just help patients really understand that yes, it is important to move, to be active. Yes, it is important to eat properly and eat well. But there's a lot of other aspects of weight that people don't realize. So making sure that you're sleeping well, but why
Mhm.
aren't you sleeping and addressing that? Making sure that you have good and great mental health and community, and also making sure that you're properly eliminating your bowels and detoxing. And so there's a whole spectrum that helps patients to understand that once we have all of these principles in place, then you're able to properly lose weight. And then we can really, really see those chronic conditions get better.
Of course. So it's not just a matter of putting people on a diet or giving them meds. It sounds like it's very much a holistic process.
It's a
Definitely.
very holistic process. Yes.
Great. And also now when you were in medical school, you did a lot of volunteer work and medical mission trips, which I think is so awesome. Can you tell us a little bit about that experience?
Yeah, so while I was on St. Kitts, with another classmate, co-founded UMHS Bridging the Gap, and it was our first volunteer club. And the reason we did that was to help connect our students with local service opportunities, which was a lot of fun. We were able to organize a beach cleanup day with a local organization. We organized a health fair. We were able to organize a dental screening seminar. We volunteered at a children's home and orphanage. So that was really neat for us as students to give back in our community. I also organized a mentor mentee program, which was to help new incoming students assimilate well to the island. I also served on the SGA as a student affairs representative, which just helped to also link the faculty with the students and just transfer back and forth what everyone needed. So that was pretty interesting. And then in residency, I got to go to Haiti on a medical missions
Wow.
trip. I was in Michigan at the time. And then in actual practice as an attending, I got to go to El Salvador, which was amazing.
Wow. And yeah, it sounds like you did a lot of really great stuff at UMHS, and now we actually have a global health mission program. But wow, I remember the beach cleanups. I didn't, so it's awesome that you were one of the people that helped start that. Finally, could you just tell us a little bit about why you chose UMHS over other medical schools?
Yes, so I chose UMHS because I first heard about it from a friend at the time who was attending and decided to do some research, called the New York office. They invited me over for an interview, and I had a really great interview, just answered all my questions. The big things I was worried about was the accreditation at that time, which
Sure,
UMHS is now accredited. I knew Dr. Ross had at the time had a lot of experience with a previous medical school, and
sure.
that school had done really well.
Yeah.
So I knew, if that school had done well, this school was certainly going to do just as well. It was amazing to see what the state of the art facilities on the island were, the help that they were already providing for students on the island, and those that were going to Maine at the time, and also the affordability. It was very, very affordable. And so just all of those factors guided my decision, and I've never regretted it.
Wow, wow, that's amazing. Well, is there anything else that you would like to add about family medicine or UMHS or anything you want to say to current or prospective students out there or alumni?
Yes, I had a lot of my great formative medical years at UMHS, not just the faculty, but the friends that I made along the way who are still friends today. And, I would say work hard. My friend group and I, we studied really hardy and we partied hardy. You can't do one or the other. It has to be both. But you need the downtime, but you also need the focus as well. And so, in order to succeed, you've got to have that community around you and to just seek help and be open to serving others, helping others, and also just um, knowing what you need to move forward.